So with that, I'll go ahead and introduce today's speaker, Dr. Suart. Celeste received her PhD in biochemistry from McMaster University up in Canada, where she happens to be zooming in from today. Her PhD work focused on spinocerebellar ataxia type 1. However, she also focused on science communication and adult education. Celeste is also the co-founder of SCA Source, a fantastic resource which is now hosted on the NAF website. And this is the knowledge translation website that makes plain language summaries of ataxia research articles. I'm so grateful that Celeste joined the NAF in April of 2023 in a newly created role as Patient Engagement Manager. In this role, Celeste leads the development of various patient-facing research communications, education materials, and informational webinars. She also acts as a liaison between NAF researchers, clinicians, industry professionals, and the ataxia community. And so with that, the floor is yours, Dr. Suart.
Thank you so much, Dr. Moore. And hi, everyone. So glad that you could join us today. We're going to be doing a deep dive into how to find ataxia information online. We won't be able to cover all of the topics. We only have an hour, but hopefully this gives you a good starting point to find some more information. So in my role as patient engagement manager, I often have people coming to me with similar expressions to these folks here on the screen. So ataxia, I have so many questions. Where do I begin? Whether you are recently diagnosed or you've had a diagnosis for a while, it can be very overwhelming, the amount of information that's out there, as well as what kind of information is accurate and reliable. It can be very overwhelming. So part of my role is helping folks navigate this. But today we're going to be going through some broad general tips to help you navigate your journey in finding ataxia information online. So the main thing is oftentimes they receive health and care information, they go to their computers. What we're going to be focusing on today is how you can find accurate, reliable, and understandable information. So by the end of this session, hopefully, if I do my job properly, you should be able to describe key features of reliable healthcare information websites, identify strategies for protecting your privacy online, which is helpful and very important when we're dealing with healthcare information, and list examples of reputable online sources of ataxia information. And don't worry about writing all this down. This recording is going to be made available through the National Ataxia Foundation in a week or so. So please feel free to sit back, relax, and try to absorb the information as opposed to copying everything down. So let's start off with website reliability. I get a lot of questions and emails about this. So here's 4 things to consider when you're looking at different websites to find out information about ataxia. So we're going to go through the 4 big questions, and we're going to go into each one in a little bit more detail. So I know whenever I am exploring a new website about ataxia, or any website really, here's 4 questions that I ask myself. The first is who owns or sponsors the website. The second is what is the purpose of the website? The third is this information up to date? Because even accurate information 5-10 years ago may be out of date now and not accurate anymore. And last, but certainly not least, who wrote the material? And based on the answers to these 4 questions, I'm able to put on my critical thinking cap and get a sense of, is this a reliable website? Should I be trusting the information that's being shared with me here? So let's dive into each of these questions in a little bit more detail. So the first is who sponsors or owns the website. So like all of you probably know, different organizations have different goals. So you want to ask yourself, why did this group create this website in particular? 4 of the common reasons that people create websites are to sell you something, to change your opinion, or go one step further, not only change your opinion, but change your actions. Last but not least, there's also websites out there that their goal is to inform your opinion. For these kinds of websites, they're not trying to, they're a little bit more middle of the road. They're not trying to make you see one perspective over the other, but they're hoping to inform your opinion so that you have all the information available in order to make an informed choice. So whenever I'm looking at a new website, I think to myself, all right, what is the underlying, who owns this website? What is their goal with creating this information? What do they want me to be doing? Do they want me to buy something? Do they want me to change my opinion, my actions? And that can inform me for the next couple of questions, give me some context in order to start off this analysis of, is this a reliable website? So some common website endings that can help you give you a little bit of clue of insight about what this website is about and who owns it. If you're in the US, .gov ends US government agency websites. If you are further up north, like me in Canada, .gc.ca, these are Canadian government agencies, so these are governmental websites. Again, if you're in the US, .edu, this indicates that this is a website for an educational institution. It's a little bit more complicated here in Canada, but .edu is a really good indicator that it's an educational website. If it's .org, this is a nonprofit organization like the National Ataxia Foundation. We're at ataxia.org. .com, this is for-profit commercial websites for the most part. And then this can give you a little bit of context in order to answer the remaining 3 questions. So after you have a sense of who owns the website, what are their goals are for the website, you can dive a little bit further into what exactly is the purpose of this website. And there's a couple things you can ask yourself here. So the first thing I like to ask myself when I'm exploring a new website is, what is the focus of it? Is it an educational focus or is it a marketing focus? These are not all of the focuses out there, but they are 2 of the common ones. So for example, if a website is trying to sell you something, they may overemphasize some of the positive aspects of whatever they are trying to sell you on and minimize some of the negatives, as opposed to an educational website, which may give you a broad overview of a particular topic or item or therapeutic, but also can be at sometimes a little bit overwhelming and a lot of detail. So there's pros and cons here, but you need to think about, we're all human, we all have our biases. If someone is trying to actively sell you something, that's going to influence what information they're sharing with you and how they are sharing that information with you. So that's the first thing I think about. What is this more educational, informational? Is this more marketing focused? The next thing to think about is it's an organizational website versus a personal website, because these 2 types of websites serve different goals. So for example, the National Ataxia Foundation, we're an organization. Organizational websites are very good at covering topics that are very broad and have a lot of information involved. It is impossible for one person to know absolutely everything. The human brain has only so much space, and you need to work with other people in order to find answers and strategies and communicate that information. So for broad topics, informational things like that, organizational websites are very good at pulling in different perspectives and different experts in order to create their content. Meanwhile, personal websites are really good for sharing personal narratives. So someone explaining how they went on their diagnosis journey, particular assistive devices they found particularly helpful, having that one-on-one perspective can be very useful for that. So there's different, depending on what the website is talking about, it may be better for it to be a personal website where it's only one person talking or sharing information with you, or it might be better to have an organizational website where you have multiple experts who are consolidating that information. Another thing that I like to ask myself when thinking about the purpose of the website is if there is on-screen advertising. So you may have seen this on some websites you visited where there's like little ads in the corner or in the text itself, breaking up the article. This is one way for websites to make money. So there are some organizations out there who their strategy or their business strategy is to try to keep people on their webpage for as long as possible so that you are seeing ads, that you may click on ads, having embedded text links so that you are brought to external websites and then they get paid a certain portion for how many people click on that link, which is fine. That's a legitimate way to bring in revenue. But as consumers, as people who are trying to find information, it's good to know or clock, all right, so this website is making money off of me however long I stay here, and how that influences the purpose of the website. Some less reputable less reputable websites out there will create information that's a little bit more confusing. So you're staying on the website for a little bit longer than you probably would if it was clearly written to try to increase the amount of time that people are staying on their websites so they can sell more ads. So it's something to consider when you're thinking about the purpose of the website. Another thing that is important to look at is if there's a disclaimer statement. Many websites will actually share specifically like a disclaimer statement of, sorry, my train of thought just broke down there. I got a notification up in the corner of my screen. Disclaimer statements. Oftentimes websites will actually state, here's what the website is for. Here's how we want you to use that information. Oftentimes these are exclusionary. So for example, on the NAF website, we'll say this information is for educational purposes only. Please consult a doctor before making any medical decisions. So we're stating explicitly, here's what our website is for. Here's what we're hoping that you gain from this. So sometimes the websites will tell you the information directly about what their purpose is. So moving on, again, you want to check if the information is up to date. So again, like I said earlier, information that was accurate and reliable 5 years ago may have changed over time. So you want to check the dates. This is an example from an NIH website where at the bottom of the page, you'll see that the content was last reviewed on May 18th, 2023. Here's an example from our website for an article that we posted about spinocerebellar ataxia type 8, a recent research paper that was published, and we did a summary of it. And this was published back in August. And then actually, sometimes if you look through Google and you're trying to find information that's more blog post formatted or news article formatted, you can see here in the corner the date that article was first published online. In this case, it's the same article as the one here from the NAF website, showing that it was published on August 18th, 2023. Now, not all pages will have dates on them for a variety of reasons. In that case, it can be helpful to check the links. So if you click on a link and instead of going to a website, you're getting these error pages like, sorry, page not found, or in Google, you may have 404, that's an error. This is a sign that the page hasn't been updated in a while, if links are broken, and it can give you some clues about if the information is up to date and when the page was last updated, if it's not explicitly said on the website. And last, but certainly not least, the fourth question, who wrote the material? So authors or editors of information should be qualified professionals. So this means different things. And depending on what kind of question you're asking, if you would like to learn more about a specific drug or therapeutic, you're going to want to go to someone who has that scientific and medical expertise to be able to share that information with you. If you have a question about, for example, IVF or how to navigate the decision about choosing IVF if you have ataxia in your family. If you have questions specifically about the science, it might make sense to go to a website that has information written by a genetic counselor or another medical professional. But if you're looking more so for the human side of things, of different opinions and how other people navigated this question, then in that case, the qualified professional would be someone who's also navigated that journey and sharing their insights and expertise into this. So again, it depends on the type of question you're asking, what kind of expertise that someone should be bringing to this conversation. So you can find out who's writing these articles and what expertise they have, oftentimes because they'll state them. So here's an example again from the NAF website, that Scott 8 article that I was previously talking about. Underneath the title, it states who written it. In this case, it was Dr. Schrank. It was edited by Dr. Nitschke, both who have expertise in this area. Sometimes websites won't list specific people who have contributed to a specific article. In the case of web pages where multiple people have written for an article, for example, we have some general information on ataxia available on the NAF website that has been edited and updated over the period of years. And if we listed all of the people who had contributed to that work, it would be an entire paragraph of people. In that case, you'll have collective authorship. So you can learn more about the authors and who are contributing to it by going to websites about us page. So here again is an example from the NAF website where we list the people in the research services team, including myself and Dr. Moore, as well as people on the medical research advisory board. So these gives you some insights into what expertise is being drawn on to create the content that's on a website where there's no specific authors listed. So for this, to give you some clues as to who wrote the material, so you look for an About Us page so you can tell you more about who's contributing to the website. You might want to look for contact information. So for example, on the bottom of the National Ataxia Foundation website, we have our mailing address, we have our email so that you can contact us if you have any specific questions. This gives you some clues that we are an actual organization with a physical address, not only a digital presence. In the age of misinformation, there are some websites out there that are created by people who want to, for whatever reason, hide their identities, hide their specific purposes of what they're going, why they're sharing this information and how they're sharing it. And on these kinds of websites, you'll have less information about the organization itself. So one of the ways to assess the reliability of a website is if they have the contact information. So you can see that they are real humans and it's not something generated by AI or things like that. This last one is, or last tip here, looking for financial disclosures is a bit more relevant if you're looking at a website that's operated by a charity. So charitable organizations, including the National Ataxia Foundation, have to release certain financial disclosures about how we are raising money, what that money is going towards. It's just another level of transparency to show that we're doing our due diligence by you, the Ataxia community. So if we go back to the 4 questions from the beginning, this has morphed into 4 big questions and some sub-questions. So again, who owns and sponsors the website? What is the purpose behind the website? Is this information up to date? And who wrote the material? So by asking yourself these kinds of questions about new websites you're visiting, you can get a sense of whether or not this is reliable information, if this is accurate information, if this is going to suit your purpose of the questions that you're asking. So usually after I go through this with someone, the next question I get is, all right, well, that's what should be happening. Can you give me some signs of unreliable websites or some common red flags to avoid? So let's go through that now. So first things first, if you are looking at a website that's for a company or organization or individual based in the US, you might want to look for FDA regulation language. Is that there? So for example, if you are looking at a website that is talking or advertising a drug or therapeutic, you will have a ton of safety information. Here's just a screenshot I took from the Skyclarys website. So that is the new medication that has been FDA approved for the treatment of Friedreich's ataxia. And this is page 1 of 17, because if I copied all 17 pages onto here, they'd be very, very small. But for things like drugs and biologics, the laws exist to make sure that they have to be both safe and effective. So this is 17 pages of explaining the safety information, who can take the medication safely, the efficacy of it, as well as any warning signs of potential side effects. So there's a lot of documentation that's required by the FDA to be provided for therapeutics like this. So that's for drugs. It's a little bit different for supplements. So for in legal terms, supplements do not need to show that they are effective. They don't need to show efficacy, but they do need to prove that they are safe to consume and use. So in this case, for supplements, instead of seeing safety information like this, you should see a statement such as like this one. So the exact statement is these statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, or cure or prevent any disease. So if you're looking at a supplement, they should have something to this effect to state that they are meeting the legal requirements to inform you that this product is safe, but they can't make any claims in terms of efficacy. If I can go to my next slide, if you're on a website that is talking about different compounds or drugs or anything that you are potentially going to be putting into your body, they should have one of these statements. If they don't, and they are a US company or based in the US, this is a little bit of a red flag that you should do a little bit more investigating about the safety of this product and talk with your physician before exploring things further. The regulations outside of the US are slightly different, but oftentimes if the company or product that you are looking into has a presence in the US, then they will have one of these statements, either the safety document here or the statement here somewhere on one of their US-based websites. Another red flag tip is to be wary of miracle cure health products. The short of it is, if it seems too good to be true, it probably is. I wish there was something out there that was extremely helpful for everyone with ataxia. Well, besides exercise and diet, we are told that all the time. But if there was some kind of miracle cure, you better believe that NAF would be the first person to be getting that information out there to y'all. The other thing that often comes up is sort of these conspiracy theory language. So one thing I've heard is, this is the cure that Big Pharma doesn't want you to know about. And when you think about the statement, it's a little counterintuitive. So pharma companies, like all for-profit companies, they want to make money. And what is the best way to make money? Having a really good product and something that works and is safe and is effective. So if there was some kind of miracle cure out there, companies like Big Pharma, they would want you to know about it so that you could pay them for it. So statements like this is something to be wary of. Another thing just to be a little bit more concerned about are claims that one remedy will cure or treat multiple unrelated illnesses. So we do know that for certain ataxia types that are closely related, there are different kinds of therapeutics that are being developed that might help multiple kinds of ataxias. However, what you want to be concerned about is when there is a supplement or a treatment that is being marketed as being helpful for multiple unrelated conditions. So something like this will help with ataxia and diabetes and rheumatoid arthritis that don't really have a connection in terms of what's happening in the body to cause these disorders. So again, one of those things to note in the back of your mind, think a little bit about, and put on your critical thinking cap to further examine things. Moving on to a couple other things to think about in terms of red flags of websites. Here are some common terms that are used in health fraud scams. Now, not all of the terms, many of these terms are used by legitimate businesses and legitimate organizations. For example, there's plenty of legitimate products that have a no risk money back guarantee. There are plenty of legitimate scientific breakthroughs that I know I write about in my position all the time. The issue is that these words have been co-opted, unfortunately, by a number of health fraud scams where you will pay for something that either will never show up or won't be mailed to you or won't be as effective as people are claiming them to be. So if you see one or more of these terms being used on a website, it's one of those things you want to double check the legitimacy of the website as well as the product. So things like ancient remedy, miracle cure, again, no risk money back guarantee, natural cure, quick fix, secret ingredient, scientific breakthrough. These aren't just specific to ataxias, they're used across multiple different kinds of health fraud scams. And then a couple of more red flags for informational websites. So again, advertisements for products in the text. This isn't necessarily a deal breaker and doesn't mean necessarily that the information is unreliable. But we do know that there are some less than stellar websites out there who they make money through trying to keep you on the website for as long as possible. So something to consider when you're evaluating a website. Additionally, websites that you have to pay to access. Now, there is exceptions to this. For example, your local newspaper may ask you to pay a subscription in order to read their articles. That's a really common way in order to be able to pay reporters' salaries. In this particular instance, these are websites that advertise that they will give you a quick fix, a quick cure. They will solve all your problems, but you need to pay us upfront in order to share this information. It's the different kind of framing where they, instead of paying a subscription or something like that, they're asking for total access to the website that you need to pay something upfront, something to be concerned about. Additionally, if a website has anonymous writers and motivations, so they don't have an About Us page, they aren't listing who's contributing to the website or what their expertise are, again, it's a bit of a red flag. You're like, well, why are you giving this information to me? What's your training? what is your expertise in this area? You can't really answer those questions if they're not giving you this information. So again, something to think about. And last but not least, limited references or expertise. So oftentimes the best way to check if information is reliable is to check with other sources, see if they're saying similar things. So if a particular article, they're not listing someone who has particular expertise in this area, if they aren't including references to outside sources. Again, it's not a deal breaker in terms of, oh, you shouldn't look at this website at all, but it's, I need to think about this a little bit more in the context of the website to see if I should continue using this. So shifting gears a little bit to protecting your privacy. So you want to keep your personal health information safe online. So here's some couple of high-level things that you can do in order to do that. So the first thing that I recommend to everyone I chat with is check for the S in the website address. So here's a screenshot of the NAF website where you can see the HTTPS. The S stands for secure. So I'm not a computer scientist. I don't know all the details behind it, but from what has been explained to me, the difference between the HTTP without the S and the one with the S is there's different levels of encryption and data privacy. So there is less of a chance of someone accessing your information through a particular website or installing different cookies on your computer. So one thing to consider, look for the S in the website. Also, you would like to read through the website privacy policy. So step one, check there is a privacy policy. Here is a screenshot of part, I couldn't fit all of it on the screen, but part of the National Ataxia Foundation privacy policy. This is a document about what information we collect and how we protect the information that we collect. If you are going to be transmitting credit card information, personal health information, any identifying information through a website, you'll want to check that they have one of these and they are doing their due diligence to protect you. Additionally, you want to avoid websites that have pop-ups and downloads. So you may have seen something like this before. So these are two common ways for phishing or malware scams, where they will install, they'll either take your private information in order to sell it online or install malware on your computer for nefarious purposes. So overall, you'll want to avoid websites that have a number of pop-ups or a number of downloads that you are not initiating yourself. Additionally, don't share sensitive information over public Wi-Fi. So this is very convenient. I know I love going to a coffee shop and catching up on some work, but you need to be careful about what kind of information you're sharing over public Wi-Fi. People can tap into it. People can see the information that you're sharing if you're not using something like a VPN or a virtual private network. So overall, if you if you need to share information online for any reason, if you're enrolling in a clinical trial or connecting with your doctor or neurologist, it's a little bit safer to transmit this information through private Wi-Fi networks like the one that you have in your own home. And last but not least, you don't want to share personal information with unfamiliar websites that you have not verified. So things like your social security number, any credit card information, your home address, your date of birth, or specifics about your diagnoses. All right, let's shift gears. We've gone through a lot of what makes a good, reliable website, what are some red flags. Here's some examples of websites that we recommend to folks all the time. And this is very important. This is a non-exhaustive list. That means that there are other great websites out there, but if I could do a whole session for a couple of hours on the number of great resources that exist online for ataxia. So these are just a few places to get you started. So first, if you want to connect with different charitable organizations, there's us, of course, the National Ataxia Foundation, but there's other groups out there like Ataxia UK in England. There's the Machado Josephs Foundation, they were in Australia. In Canada, there's Ataxia Canada, and these are all charities that have some great resources out there in terms of navigating your ataxia diagnosis, finding support, connecting with other people, and connecting with your community. So they're great places to start. There's also different information available through different healthcare systems. So for example, there is the NINDS, or the National Institutes of Neurological Disorders and Stroke, that's available through the NIH. They have information about ataxia. The NIH also runs Medline Plus, which has a bunch of really great lay summaries about a variety of medical topics, including ataxia, as well as if you have different medication that you're interested in learning more about. That's a great place to start in terms of getting some basic information about safety of medication. Medline Plus is great for that. Also, in the UK, the NHS has great information available about ataxia. There's also different hospitals and universities that have information about a variety of different conditions, but here are some links to the ataxia-specific resources. So for example, the Cleveland Clinic has great resources, so does Johns Hopkins, as well as the Mayo Clinic. So these are some places to get started. All right, just checking for time. We are going to do a quick activity together. So we're going to try out what we've learned today through examining a website. So if you give me 1 second, I'm going to pull that up. And then we'll go through it together. All right, if someone could just let me know in the chat if you are seeing a web screen right now from WebMD, ataxia, what are the types? Amazing, thank you so much. So we're going to be going through this article, and I'm going to narrate what the thought process that I would go through if I was exploring this as a website new from the first time. So here is WebMD. To get to this, I Googled what is ataxia, and I clicked the WebMD article. And right off, we are off to a really good start. At the very top, they have said who has written and who has edited the article, and it has a date. So this was written or reviewed in 2022. So that's not too long ago. This is fairly recent. We're off to a good start. But then if we look at who it was written by, it was WebMD editorial contributors. Okay, so this is a collective writing. It doesn't specifically say who it is, but we could go through the WebMD's About Us page to see what kinds of staff writers they have and what their expertise is. For now, due to our time limits, we're not going to go through that. But if we go back to this main article, we see that it was medically reviewed by an MD, fantastic, a medical doctor. That's a great place to start. We can click through to see who she is. But if we read her bio, she is a doctor, but her focus is on dermatology, which fantastic dermatologists out there, not super relevant for ataxia, where there's a variety of different medical specialties who help provide care for folks with ataxia. Neurologists, geneticists, different cardiologists, for example. But we don't see a whole lot of dermatologists in this area. So she doesn't quite have the expertise in terms of being able to speak to this subject. All right, but going through the top of the article, again, if we click on the web link here, there we go. This web link is secure. We can see the S in the top corner, so it is a secure site. That's also a good sign. And then we can start to go through the piece. Well, we're already seeing some in-text advertisements, which is not fantastic for a website like this, where it's more informational. We'd like to see this without ads if possible. And we're also seeing that the information here is not 100% correct. So ataxia is a common symptom of other neurological disorders, but saying that it's a sign of other underlying disorders or diseases is not 100% accurate. There are some disorders that are ataxias. So but if someone was reading this for the first time, if they didn't have that background knowledge, they might not know that, and they might get off on the wrong foot in terms of finding out information. But if we go through things a little bit more, they have it's clear and short. So that's a good sign. Again, we are seeing advertisements that are throughout the article, which is a little bit distracting. And then I'm just going to scroll down to the bottom here. Another good sign is that they show sources. So they have the different sources that they're citing, including the National Ataxia Foundation. So thank you, WebMD, for citing us. And if we scroll down here further, they have a privacy policy and an About Us page. So those are both fantastic signs. For now, we'll just skip over that for the sake of time. I'll exit out of that. But one thing that you wouldn't necessarily know when you are first reading this article is WebMD they're not super transparent. They're a for-profit company. So the way that they make their money, again, is through advertisements like this, as well as affiliate links, like this one, for example. It takes you to a company that you can pay to help you qualify for Social Security. And WebMD gets paid for the number of people who sign up through their affiliate link. Again, this is not necessarily a bad thing. It's a way that multiple websites make money, but it's something to consider when you're thinking about what biases a writer may have, and what is the purpose of the website. All right, so that is a quick, so overall, there's some good things about how this website, there's some not fantastic things. So it's sort of a mixed bag in terms of, there's probably some better sites out there, but it's doing a fairly good job. So if this is your first article of figuring out a little bit about ataxia, it will set you off in the right direction. And with that, I'm going to bring this back up. That's all I have for you today, folks. So thank you so much for listening. I'm going to turn off my PowerPoint screen now so I can better see the chat, but I'm happy to take any questions you may have. That was a lot of information very quickly.
Thank you, Celeste, for that wonderful presentation. And just a reminder to please insert your questions into the Q&A and I will ask them on your behalf. So the first question we have is actually from another fellow Canadian. So the question says, I'm from Windsor, Ontario, and find that Canadian resource materials are scarce both online and offline. And it appears that there's significantly more resources found in the US with respect to ataxia. Are there any services offered in the US that are available to non-residents?
That is a very good question. I often find the struggle as well due to our differences in population size. A lot of the information when you type into Google, it automatically comes up for US-based sources as opposed to Canadian ones. It depends on the services that you are looking for. There are some that are very specific in terms of you need to be a US resident. For example, we have a genetic testing program that you need to be living in, the National Ataxia Foundation, where you need to be living in the US in order to access that service. However, we have other services and information that are available to folks outside of the US, such as our support groups. There's a very active support group for ataxia based in Ontario, which is fantastic. If you're in the Windsor area, connecting with them might be a good place to start. In terms of accessing different healthcare services as well, if you go to specific organizations' websites, they'll be able to give you a bit more information about whether or not they offer services to folks who are not permanent residents of the US. From my knowledge, there are different ataxia centers of excellence and other organizations out there that do take international patients. It depends on, you need to do a little bit more digging, which is a little bit more of a challenge, but it can be very rewarding. The other thing that I would add into that is connecting with Ataxia Canada. They have a lot of information specifically about ataxia resources in Canada, and they've done a very great job of curating that list.
Wonderful. I'll also mention the Ataxia UK, which has great resources across the pond.
Yes.
So there's one question about the research papers that you find from PubMed. Are those always to be trusted? How can we evaluate those articles?
Oh, that is a very good question. A lot of this talk was very much focused on healthcare information as opposed to research information. So if you're not familiar, PubMed is a library that has been curated by the US government. It is a repository of research articles that are available online. And it can be a little bit tricky navigating this in terms of reliability. I'd say about 80 to 90% of the articles that are indexed in PubMed are solid work. They are published in reputable scientific journals. Because PubMed is an indexing library, they index things very widely. Every once in a while, you have what we call predatory journals. which publish less than stellar scientific papers that sometimes sneak in there. And there is a team that is working very hard in order to curate some of this and remove some of those articles. But overall, I know whenever I'm trying to research information about ataxia and getting into that nitty-gritty details about the scientific research, PubMed is the first place I go to, as overall very strong, very reliable information. But if you are clicking through the links and then you get to a scientific journal website that doesn't meet the criteria of what we discussed today, like I know once I clicked through an article and it's like, this seems a little bit off. And then I went to the website and there was ads everywhere and they didn't have any contact information and they didn't say who was the editor of the journal. And then there were some red flags there. So it's those things. I'd say PubMed is a very good starting place, but then the same things we discussed today in terms of website reliability, you can apply those to journal article websites as well.
Yep, and I'm seems like many of the same questions that you apply to, is this website reliable, also apply to papers, where you can see the authors. Oftentimes you can see who the authors are. You can look up the journals that are publishing them, and you can see if they really are experts in the field and if it's a reputable journal. And just one other thing I'd mention about PubMed is oftentimes there are paywalls to accessing these articles.
This is true.
And there are some ways around this, such as emailing the author directly. I found that useful before.
Yes, as a former academic, nothing made me happier than someone emailing me to say, "Oh, could I have a PDF of your article? I'd really love to read it." It's the knowledge that someone is interested in the work and that they'd like to learn more about it. It's not going to be a bother whatsoever. People like getting those emails.
Can you tell us a little bit about how to find good information about clinical trials?
Ooh, this is a very good question. And we have some, and I'll give you a little insight and a secret. The National Ataxia Foundation, we're creating some resources right now in order to help people do this. But before that takes time to make, the #1 website I would recommend is clinicaltrials.gov. This is a website that is run again by the US government, but it curates information about clinical trials all over the world. They have a bunch of different search features that we're preparing a guide about how to use the search features accurately, because it can be a bit overwhelming at first, to narrow down clinical trials by the type of condition. So if you want something, if you have SCA3, for example, and want clinical trials that are just recruiting folks for SCA3, you can focus just on one specific disease type. You can focus on the geographic area. There's different search functions about the different types of trials. So if you want something that is observational, so they're not giving you a drug or therapeutic to try, you can find it through there. If you want something that you're testing out a new drug or therapy, you can search just for trials like that. There's a bunch of different search features. And thank you, Molly, for dropping that link in the chat. Now, again, it is a fantastic tool. It can also be very overwhelming with the amount of information it gives back. If you are looking for a more curated list that is a little bit smaller and a little less overwhelming, on the National Ataxia Foundation website, we have a Participate in Ataxia research page, which includes a variety of links to more information about both clinical trials as well as basic research studies. These are researchers who have reached out to the National Ataxia Foundation, saying specifically that they would want to recruit patients with ataxia and share this information. So this is a shorter list. We try to keep it up to date and review it as often as we can. But it's a bit of a shorter list, but more targeted in terms of focusing specifically on different kinds of ataxia. So that's also a good place to start.
Wonderful. So there's a question about, and maybe this is a bigger question for this talk, but are there certain divisions or groups within the FDA or other government or federal groups that focus more on ataxia and drug development?
Ooh, Lauren or Dr. Moore, you're going to have to help me out with this a little bit. My Canadian-ness is showing, but there is. It depends. Or 1 second. What is the question again? If you're speaking specifically about the FDA, that organization is broken up depending on what type of therapeutic you're talking about. And then within those, they have specialist groups that focus on neurology. So for example, if you have a medical device, they have a medical devices group. So things like walkers, rollators, grab bars, different, oh, the English word just went right out of my head. Pacemakers, there we go. So they focus more so on approving those kinds of devices. There's one specifically for different drugs. So things that if it's an oral medication or something being injected into your blood, they focus on that. There's other folks that focus on biologics, so things like gene therapies. Overall, though, in terms of research at the NIH, I think we included the link to the NINDS, which is the research arm of the NIH, which focuses on neurological disorders. So broadly speaking, there's that one. In terms of drugs, Dr. Moore, am I missing anything here? Those are the main branches of the FDA and NIH focusing on cerebellar ataxia.
I would just say that there's multiple initiatives that are focusing on the development of therapies for rare diseases. And those are within the FDA. I can't think we speak much about them during this talk, but we can share resources at a later time.
100%.
And I'll just mention again that this video will be available to watch through the NAC YouTube page and on other pages, and Molly has put those links within the chat. There's a question about whether support groups might be a good resource for information.
I really love support groups. I know I'm a member of them myself for a variety of different reasons. Being able to connect with people who have similar lived experience to you, who understand what you're going through without you having to really explain things in a whole lot of detail is incredibly valuable to have those kinds of connections, and are a great place to start, and also a great place to share resources. So I am very much pro support group in terms of finding that supportive connection and sharing information. I know I found it very valuable when connecting with different support group members and them sharing articles with me on different information. So yes, that is a great starting point as well in terms of being able to, especially when you are newer to your diagnosis, or you have decided, I haven't participated in research before, this is something I want to try, something new. Chatting with someone who has done that before can be incredibly valuable in terms of figuring out the ins and outs of things, figuring out some of the implicit information that is not explicitly stated in terms of what's involved. So having that personal connection with someone who's going through the same thing you are is really, truly helpful.
There's a question about studies that occur outside of the US, such as some of these very experimental uses of stem cells in other countries. Can you talk a little bit about ways to evaluate clinical trials that are happening outside of the US or experimental treatments?
100%. So I'll first start off by saying that we have a statement on stem cell research that's available through the National Ataxia Foundation. And oftentimes for these sort of more experimental treatments, different organizations, including ourselves, Ataxia UK, I think the MGD Foundation also has a statement on this, because a lot of people are looking for guidance. It's like, this is outside of the regulatory systems that I'm usually a part of. It's not FDA approved or being governed by the FDA. What's a safe thing for me to do? So if you look at the statement made by the National Ataxia Foundation, in this particular case, there's a lot of promise to stem cell research that are happening in laboratories right now. I know a number of grad students and postdocs who are working tirelessly to try to figure these things out. But it's still very early days. It's showing promise, but it's showing promise in a dish of cells. We haven't quite at this moment moved past cells in a dish and maybe some very small animal models. There is some preliminary work being done outside of the US and outside of North America, trying to move this work into human beings. Unfortunately, we've also had some reports of this preliminary research. People are very excited. They want to move as fast as possible. And alas, we've kind of skipped over safety in some of these trials, which can be very disheartening for folks to hear. So the question was trying to evaluate these things. First off, go to the different charitable organizations that you're already connected with online. They may have a statement about these kinds of research and to give you a little bit of guidance. In the case of stem cell research, or I misspoke, in terms of stem cell therapies, the National Ataxia Foundation, our position is that there's a lot of promise in the years to come. Right now, we're not in a place to go into human trials, and proceed with caution. When you're looking up information about these things online, they sometimes give a very skewed perspective. Going back to, I'll loop back to this, but going back to support groups, a lot of times connecting with folks who have unfortunately participated in these trials and have had negative experiences. I know I've chatted with folks who've had that experience and are sharing that on different support groups now, so people aren't led astray like they were through different websites. But connecting with the different organizations about what information is available on this treatment, how safe it is, why is it happening in the place that it's happening. And there can be different reasons why trials happen outside of the US or inside the US. For example, we had a recent talk from Dr. Soji Shuji out of the University of Tokyo, and they're running a clinical trial on MSAC just happening in Japan at the moment. And the reason why that's happening there is a critical mass of people with the same kind of mutation that's causing the same kind of ataxia. We don't have the numbers base in the US for that. So that makes a whole lot of sense why it's happening there. But if a trial is happening somewhere else and and the reasons why it's not also being done in the US could be connected to safety, such as stem cell research. That's one of the things you need to think about. That was a very long, rambling statement, but check with your professional organizations, see if they have any sort of statement or guidance on this, but also connect with your care physician. They would have some great resources in terms of helping you chat with you about what might be a safe trial to be taking part of and what might be a little bit more of a healthcare scam.
I would also note that about every country has an equivalent of the FDA that regulates clinical trials and experimental therapies. So I would see in the country that it's being held in, what is the regulatory body, and does this study meet the standards of their equivalent of the FDA? Exactly. Also, you can typically see who's sponsoring the study and who is the lead investigator in the study. So you can do some research on those as well to see if they're reputable and relevant to the treatment of ataxia.
No, that's a great point.
And let's see, what other questions do we have? Just a reminder, we still have a couple minutes left, so if you have any questions, please feel free to throw those into the Q&A. So how can you find some information about where to get good healthcare for ataxia?
Ooh, this is a very good question, and one that I get a lot in my inbox. If you are based in North America, or we're now expanding to internationally as well, a great place to start is the National Ataxia Foundation's Ataxia Centers of Excellence. We have a list of different clinics around the world, mainly in North America, but some in Europe, Australia, as well as South America as well. We're growing. And these are clinics that we have gone through and verified that they have the right expertise, they have the right staff, the right resources available in order to give you an all-around excellent quality of care in terms of ataxia care. Now, not everyone lives within traveling distance to one of these Ataxia Centers of Excellence. So we also have a comprehensive list of different movement disorders centers and different neurology centers, which may not be as specialized in terms of knowledgeable about ataxia, but they are excellent neurologists and they'll be able to give you an excellent quality of care. Other charitable organizations such as Ataxia UK, the Machado Josephs Foundation, as well as Ataxia Canada have similar lists for their geographic regions. So overall, connecting with different charity organizations in these specific areas, oftentimes they'll have some guidance about where to start in terms of trying to access care.
Wonderful. I think that is all the questions that we've had today. So if there are no more questions, I'll go ahead and thank Dr. Suart again for her wonderful presentation. And thank you all for joining us today.
Thanks, everyone.